Hello, Dr. Sheila here, better known as the Pelvic Coach. And today we are going to talk about menopause and urinary tract infections. Urinary tract infections in some women become more frequent during the menopause and postmenopausal years. Now, one of the main reasons for that, or one of the reasons for that actually, is just simply an anatomy type of reason. Our bodies are different. See, men don't get them as much because we both have the urethra, which is where the urine comes out of. But ours is really, really close to our body, right? It's right up above your vaginal opening. So it's kind of up there. And it's really a straight tube. So any bacteria that gets anywhere in that area can shoot right up to your bladder and thereby cause a urinary tract infection. In men, of course, it has a further way to come out. It comes out through the penis. So, they have less urinary tract infections. So that's the first thing actually is an anatomy type issue. The second one is, and it has to do with the menopause. Menopause hormones start to wane, correct? Estrogen wanes. Vaginal tissue starts to thin out. So the tissue is not as rigorous or not as able to even be that barrier against bacteria because it's thinner. And there are things that you can do for this. Your physician can certainly recommend creams, some types of interventions that are prescription, usually prescription only. They do have some that are over the counter, but depending on how much vaginal thinning you have will depend on what you need. That will be able to help with that. But also, the menopausal period can actually contribute to UTIs for women who have incomplete emptying. So what that means is that when you sit down to go to the bathroom to urinate, that all of the urine does not come out. So there's more than your residual urine left. And this can actually harbor, well, urine does harbor bacteria, actually, if it stays in your bladder for too long. So you want to make sure that when you're going to the bathroom, you are sitting down, right, so that those muscles can relax. And then not rushing. So making sure that you're able to let all of the urine, come out. Even after the stream, if there's even more to come out, give it a chance to come out. If you are a person who feels that you actually are not emptying out all the way, what you can do is you go to the bathroom, urinate, and if you're still like, I don't know if I got it all, you can even stand up and sit back down and see if any more urine comes out. That might help you with incomplete bladder emptying, just shifting your position and then sitting back down, relaxing, of course. Okay, so incomplete bladder emptying is also one of the reasons. We talk about pelvic organ prolapse a lot, or somewhat anyway. I think it's a lot, but maybe you don't. And pelvic organ prolapse, especially if your bladder drops, right? Even if your uterus drops, you don't really have the same straight, you might have difficulty getting all of the urine out, or even difficulty initiating the stream. So if you're feeling like any of these things are happening, you need to consult your physician, right? And get some medical guidance, or even a health professional, because therapists can actually assist you with that. But if it's bothersome, if the problem is really severe, certainly speak to your physician about it, for sure. The next thing is, we talked about the lack of estrogen, but I talked about it kind of in a roundabout way. So the lack of estrogen, which causes a vaginal thinning, which causes perhaps the muscles to become weak. There is no perhaps, it actually does make it progressively weaker, but it depends on how weak. That depends on you, right? And what you can do to maintain your body. Because as you know, it's work. It's work to maintain health and maintain your body functioning the way it should. So to summarize, why do I get more UTIs with menopause? Vaginal thinning, muscle weakness, right? A lack of estrogen or decreased estrogen. Pelvic organ prolapse from a multitude of reasons. Just muscle weakness. It could be muscle weakness, muscle tightness, having several children, an injury, medical condition. Also, incomplete bladder emptying, which we talked about what you might be able to do about that. To be able to adjust that, because you want to make sure that you get all of the urine out when you're trying to go to the bathroom. Stay active. Try to wipe from front to back, right, when you're wiping. So don't wipe the bacteria up towards your urethra, because that small little straight tube can carry it right up to your bladder. So hopefully some of these tips helped you if you are someone who is struggling or who you've had frequent urinary tract infections with aging and with menopause. There are things that you can do. Don't ever think that all is lost and you are not able to, I don't want to say the word fix the problem, but that you're not able to change things that are not working correctly in your body so that you are happy. All right. That being said, I'm going to sign off. Just a reminder, if this was helpful to you, please go ahead and subscribe to my channel. And I look forward to talking to you again next week for our next topic on the bladder leaks, and probably why, when, why, how, is all of that together. You all take care until next time.